Very good afternoon to everybody, the distinguished members on the dais and the people who have come down on Saturday and attend this conference. I thank you, Raghavendra sir, for organizing this and giving this opportunity to National Health Authority. National Health Authority, I think this is a patient-centric conference, so mostly would be around what we are doing to transform healthcare in India. The National Health Authority is a very new institution, although it's called authority, but it's not a regulator currently. So National Health Authority came into being in 2018. In 2018, we started with, most of you must be knowing about it, Ayushman Bharat scheme. Ayushman Bharat scheme provides a family floater free of cost, 5 lakh rupees insurance cover to around 40% bottom population of India. It's a centrally sponsored scheme, so central and the state government both contribute to this scheme, and combinedly they have spent around 81,000 crore rupees in that scheme. So in this scheme, people who are beneficiaries, who have been identified as a beneficiary, they can go to any empaneled hospital and get their treatment done. We cover around 2,000 different procedures which are covered in that scheme. But today, what more I'm going to talk about is about a digital mission which was launched very recently. In 2020, it was piloted in 6 Union territories in India. And then in September 21, we came up with this national launch of Ayushman Bharat Digital Mission. Ayushman Bharat Digital Mission talks about, if I can combine it into one word, it would be the patient centricity. So the wellness of the patient is the center around which Ayushman Bharat Digital Mission is built. Ayushman Bharat Digital Mission has the patient in the center, patient consent at the center, patient data at the center, on all things that we do in Ayushman Bharat Digital Mission. In Ayushman Bharat Digital Mission, what we do is we distinctly identify all the stakeholders of the health system. It might be patients, it might be doctors, it might be hospitals, it might be other facilities or the services of the doctors. So all these things are uniquely identified. With unique identifier, we all know what is unique identifier by now. We know what is Aadhaar. Aadhaar is a unique identifier, but also it is a digital unique identifier. Aadhaar, you don't have to carry your Aadhaar, you don't have to carry a printout of the Aadhaar, you don't have to remember your Aadhaar. You can authenticate yourself by using Aadhaar. Only the 4 digits of the Aadhaar you can authenticate yourself that you were present at that time. So it's a digital identity. It carries with you. It goes with you wherever you are. So it's a digital identity. Similarly, we have come up with a health account, which is a digital identity for every patient. So these health accounts, what does health account do? Health account could be closely compared with a bank account where you keep your financial transaction. In a Ayushman Bharat health account, you can keep your health transactions. In health transactions, what we'll have is any transaction that you have had in any of the hospitals is a health transaction. Any services, healthcare services that you have received or you are providing, those will be the health transactions. We want to transform them into a digital way, and then we also want them to be available to the patients. So all patients can have their digital health transactions on their own for their own usage. So this goes if a patient goes to one doctor, have one teleconsultation there, or goes physically to a doctor and has a teleconsultation there, and then goes to a lab, then he doesn't have to carry the printout of the advice that the doctor has given to him. He can share the digital prescription to the lab. The lab can do the test and then share the digital copy with the patients. Now, most of you would say that is available right now also. Different apps are doing it, different platforms are already doing it. People are sharing their digital health transactions on WhatsApp, on PDFs and emails, etc. But then these are not interoperable. So now the best thing in Ayushman Bharat Digital Mission is the interoperability. By the interoperability, I mean that if you go to any hospital, any doctor, if it is following the same protocols or same standards, then whatever transactions that the doctor or the hospital or facility is doing will become interoperable. So we and you are able to communicate on email from Gmail to Yahoo Mail or we can call from Airtel number to Jio mobile number, because Why? Because at the back end they both are following the same standards and protocol, and therefore ABDM also asks that interoperability is the key. So when interoperability of the services happens, it happens that you can go anywhere, but you are able to get those records directly on a single platform. And this interoperability has that all patients can have their digital health records on their mobile phones, and therefore from episodic or when I need care, I go to the doctor and take care. So from that, we'll transform it to wellness center. So I'll be able to track my health records properly, and therefore patient would be able to dedicate more time and be able to manage their health in a proper way. And therefore, from an episodic care, we'll be transforming it to a wellness centric approach in Ayushman Bharat Digital Mission. So this unique identification has been done for health professionals, for facilities, for patients, etc. And various use cases are out in the market now. Most of the public hospitals are also using those use cases where patients are coming to OPDs and only scanning a QR code and sharing their records to the hospitals, not waiting in the OPD counters for lines and getting themselves registered. In some of the hospitals, patients are directly scanning the QR code of the doctor and consulting the doctor. In the public hospitals, they don't have to wait at various lines now. Similarly, new use cases are coming up where we'll be able to share our records to the doctor directly by scanning QR codes. Various things. So patient consent has been taken into account in Ayushman Bharat Digital Mission, and this interoperability of health services, health claims, health data, etc. is going to transform how healthcare is provided and consumed in India. We all have changed how we transact on financial matters or different things now. So everything has come onto a digital platform, and this transformation is going to come to India. Most of you must be knowing that Ayushman Bharat Digital Mission, we have uniquely identified around 59 crore Aadhaar accounts are already there, and similarly new things are coming up. So this is a transformation we are thinking that it is going to come very very soon in India, and this is how we are going to change how patients and doctors deliver also and also consume health.